Can you spot the woman who will have a high-risk pregnancy? Is it Susan, who is 37 years old, and after years of trying to get pregnant, went to a fertility specialist who recommended in vitro fertilization? Or Melissa, 24, who has successfully managed diabetes since childhood? She's married and has never been pregnant before. Or Lindsay, 17, with all the characteristics of a troubled teen. She is sexually active, smokes, drinks, and uses recreational drugs. Or Jan, 31, and considered obese because of her high body mass index. She has a history of hypertension, but it's now controlled with medication. Which woman did you pick? If you answered all of them, you are correct. Each of these women faces risks associated with pregnancy, both for themselves and their babies. This program will focus on Susan and Melissa, while part 2 of this program will discuss Lindsay and Jan. The American College of Obstetrics and Gynecology, or ACOG, classifies pregnancies as either normal or high risk. Although there is no universally accepted definition of a high-risk pregnancy, it is one in which complications are more likely to occur, and the chance of maternal, fetal, or neonatal morbidity or mortality is higher than usual. Pregnancy can be described as high risk if the mother is older than 35 or younger than 18 years and or underweight or obese. Other factors that may cause complications include a chronic comorbidity such as hypertension, cardiac disease, asthma, or diabetes, a multiple gestation, maternal structural abnormalities such as a double uterus or small pelvis, a family history of genetic disorder, a substance abuse problem, poor nutritional status, and or a fetus with structural or genetic abnormalities. Susan, a primary school teacher, has wanted a baby for a long time. After trying to get pregnant for 2 years without results, she was seen by a specialist, where she underwent in vitro fertilization. The 3rd attempt was successful, and she was referred to Dr. Kenyon, a high-risk OB/GYN, for care during the pregnancy. This is her first visit to the office. Susan is considered high risk for several reasons. One is her age. Women classified as having advanced maternal age, or over age 35, are at increased risk to have babies with genetic or chromosomal abnormalities. They are also more likely to need cesarean deliveries. In addition, she has undergone an assisted reproductive technique that is often associated with multiple gestation. So how are you feeling?
I'm a little queasy in the mornings, but it's nothing I can't handle. I'm a little nervous. My husband's gone on a business trip and he won't be back for another week.
I understand. Well, perhaps you can come in for one of your next appointments. Now, try to relax. I'm just going to go over your medical history with you, take your vital signs, go with you to ultrasound, and then you'll meet with Dr. Kenyon. Now, stop me at any time you have any questions, okay?
Okay, that doesn't sound too bad.
It's not. It's very easy. Let's start with something simple. Your family. Now, Susan, tell me about yourself and your husband. Are you both in good health?
Yes, so far, we've been very lucky. Neither of us has any serious illnesses or injuries. We don't even have allergies.
Well, have either of you ever been in the hospital or had surgery or had a blood transfusion?
No, never.
Have you ever had any anesthesia?
No.
Have either of you had a sexually transmitted disease?
No.
Susan, do you smoke or are you exposed to secondhand smoke?
No.
Do you drink alcohol?
Not very often, sometimes a glass at dinner.
Do you use recreational drugs?
No.
Susan, have you ever been pushed, slapped, kicked, or otherwise hurt by your husband or someone important to you?
No.
Have you ever been insulted by your husband or someone close to you?
No.
Has your husband husband or anyone important to you ever force you to engage in sexual activities?
No. Why are you asking me these questions?
I have to make sure you're not a victim of or at risk for domestic violence.
Everything's fine.
Good, good. Now, just one more question about this. Has your husband or anyone important to you ever screamed or cursed at you?
No.
It is vital that practitioners know the laws regarding mandatory domestic violence assessment in the jurisdictions where they practice.
Okay, Susan. Now a little more about you. When did you start your periods?
I was 13.
Were they regular?
About every 4 to 5 weeks.
Have you ever been pregnant before?
I had a miscarriage about 3 years ago.
Oh, I'm sorry. That's never easy to go through.
That's right. I was very disappointed. I was about 7 weeks along.
Spontaneous abortion, or miscarriage, which occurs in approximately 20% of all pregnancies, accounts for the majority of pregnancy losses. Risk factors causing spontaneous abortion may include pregnancy resulting from assisted reproductive technology, chromosomal abnormalities, advanced maternal age, reproductive tract abnormalities, chronic maternal diseases such as diabetes and hypothyroid, hormone imbalances, autoimmune disorders, and maternal infection. Once a woman has had a spontaneous abortion, she has a 25% chance of having another.
Susan, I see you have gone through in vitro fertilization for this pregnancy.
Yes, we tried for over 2 years to get pregnant, and then we went through 2 in vitros. I guess the third one's the charm.
That's great. I'm glad that the in vitro was finally successful for you.
Over the past 2 decades, the use of assisted reproductive techniques has increased dramatically and made pregnancy possible for many infertile couples. IVF pregnancies are not without problems, however, as they are associated with multiple gestation, prematurity, low birth weight, and perinatal mortality.
What about your parents?
They're fine. They're retired and live in Arizona. My dad has some angina, but it's mostly controlled by medication. And Mom has some arthritis in her hands.
Any cancer in the family?
My uncle, my dad's brother, died of lung cancer years ago, but he was a smoker. I think my dad's father had colon cancer. He died more than 20 years ago.
What about on your mother's side? Is there any heart disease or cancer there?
My mother's only brother had a triple bypass several years ago, but no history of cancer.
Okay, do you know of anyone in either of your families with a genetic abnormality, like
Downs?
Yeah, like Downs, yes, or Tay-Sachs, cystic fibrosis, even a cleft lip or palate?
No, nothing like that.
Good. Let's move on to your husband's family.
Okay.
The nurse continues questioning Susan about her health and family history. It has been determined that there are no genetic abnormalities on either side. In fact, chromosomal studies done by the fertility specialist before implantation showed no genetic anomalies.
Well, it looks like your previous fertility specialist performed all of the standard pregnancy lab tests. Let's see. Now, glucose is fine. Viral function's okay. Viral titers are good. You don't have HIV or any other sexually transmitted infections either. Now, these are all routine tests. They run on all women who want to become or already are pregnant. Now, I see you have been taking prenatal vitamins and extra folic acid since before the in vitro procedure.
That's right.
Well, let me explain what we'll be doing today and for the next several months. Now, each time you come in, I'll check your vital signs, weight, and urine. Today and again in a few weeks, we'll be doing an ultrasound. Now, we do that for a few reasons.
To see if I'm having more than one baby. I know I'm at risk for multiples.
That's right. Now, you have between a 20 and 40% higher chance of having more than one baby than someone who didn't undergo the treatment. So, we'll definitely look at that. We will also check baby's size and how he or she is developing.
Is there a problem? I know Dr. Miller, that's the fertility doctor. He said I have a high-risk pregnancy. What does that mean?
Well, that means there is a greater chance that you may, now let me emphasize the word may, have some complications. You have what we call risk factors, things that may affect your pregnancy. One is your age. Pregnancy just gets harder as you get older.
And another would be that I might have more than one baby?
That's right. Since you're in good health, your labs are fine, and you've done some pre-pregnancy preparations such as taking the vitamins and folic acid, I can't think of any other factors that might complicate things.
I've done some homework. I watch my diet, I exercise some, I get plenty of rest. I've been waiting for this baby for a really long time.
It sounds like you're doing a good job. Now remember, if you have any questions about anything, don't hesitate to call. Now I'm going to check your vital signs.
Okay.
Well, now your vital signs are fine and within normal limits. So now let's go to the ultrasound, and then Dr. Kenyon will perform his exam.
Wonderful.
Melissa, a 24-year-old woman, was diagnosed with diabetes when she was 12. She is regularly followed by her endocrinologist, who closely monitors her for signs of retinopathy, cardiomyopathy, kidney failure, high cholesterol and triglycerides, and other complications associated with the disease. So far, her glucose is well regulated and she is doing fine. When she and her husband decided to have a child, Melissa spoke with the endocrinologist, who told her that because of her tight glucose control and lack of vascular disease, she would probably have a successful pregnancy. Spontaneous abortion and congenital malformations, the physician noted, are more common in women whose glucose levels are not well managed. The endocrinologist then referred Melissa to an OB/GYN with experience working with diabetic mothers. Before she became pregnant, Melissa met with her new OB/GYN, Dr. Glass, who was pleased with the results of the endocrinologist's workup. Melissa was put on prenatal vitamins and a folic acid supplement. 2 weeks ago, Melissa saw Dr. Glass again, and she confirmed her pregnancy and ran additional lab work to check her serum glucose, hemoglobin A1C, BUN, and creatinine. Her urine was also checked for glucose, ketones, and protein. Melissa is back in the office for a follow-up visit.
Hi, Melissa. How are you doing? Great. I'm 6 weeks along. So far, so good. Well, all the lab work taken at your last visit came back fine, and your hemoglobin A1C is 5%.
The hemoglobin A1C test provides an estimate of glucose control over the previous 2 to 3 months. A level of 5 to 6% or less is associated with a fetal malformation rate that is close to that found in non-diabetic mothers. A level of 10% increases the risk of anomalies such as cardiac defects, ancephaly, spina bifida, and skeletal deformities to 20 to 25%.
That's good. Being diabetic, I have enough to worry about.
Because she is diabetic, Melissa's pregnancy is considered high risk. She has an increased chance for spontaneous abortion, preeclampsia, uteroplacental insufficiency, need for cesarean delivery, and exacerbations of diabetes-related complications. Maternal diabetes can also affect the fetus and cause not only structural anomalies, but transient hyperglycemia and hyperinsulinemia. These two states can lead to excessive fetal growth or being large for gestational age, making delivery difficult, thus increasing the chance for birth injury. In addition, there is a greater incidence of fetal demise, especially with women who have poor glucose control. Once born, the infant of a diabetic mother is at risk for developing hypoglycemia, polycythemia, respiratory distress syndrome, hyperbilirubinemia, or electrolyte disturbances.
We'll work together to make your pregnancy as easy as possible for you. How often are you checking your blood sugar? I'm following the schedule you gave me. I check fasting blood sugar in the morning and 2 hours after meals and at bedtime. My levels have been pretty good. Do you want to see them? Yeah, I have them here in this log. You're doing a great job recording them, Melissa. Thanks.
Pregnancy causes increased insulin resistance, largely due to the high levels of the placental hormones, which increase with gestational age. Therefore, serum glucose levels must be closely monitored. Levels are optimally kept in a tight range during pregnancy and are typically assessed by checking fasting blood sugars, which should be between 60 and 95 milligrams per deciliter, and 2 hours postprandials that should register between 100 and 120 milligrams per deciliter. Maintaining these levels can be anxiety-provoking for some women, especially those who have poor eating habits and erratic compliance with their drug regimen. However, with assistance from the prenatal team, as well as the endocrinologist, many women learn the routines and management skills needed to keep their glucose in check.
Melissa, I see a few high peaks here at 150. What happened? I'm afraid of being hypoglycemic. I hate when I get all shaky and confused, especially if I'm home alone. There is a risk that your levels may get low every once in a while because we're trying to keep your glucose within such a tight range.
At the same time the women are counseled about controlling their hyperglycemia, they also need to be aware of the signs of hypoglycemia, which is most common early in pregnancy because of transfer of maternal glucose to the fetus. Maternal symptoms include tremors, confusion, cold sweats, and headaches. Even though this state is of consequence to the mother, it has not been associated with adverse fetal outcomes. Later in pregnancy, as insulin resistance increases, there is a reduced chance of low blood sugar.
What can I do to keep my levels within normal limits? Let's talk to Dr. Glass and your endocrinologist to come up with a plan for you. Okay. Is there anything else for today? First, I'll check your vital signs, and then you can see Dr. Glass.
Over the months, Melissa's glucose levels will be closely monitored, and she will be evaluated for fetal complications associated with her diabetes. She will have periodic ultrasounds to assess fetal growth. At 18 to 20 weeks, she will have a targeted ultrasound to look for fetal anomalies, as well as to evaluate the anatomy of the heart. In addition, her blood will be checked. Between 15 and 20 weeks, a triple marker screen, which looks at levels of alpha-fetoprotein, human chorionic gonadotropin, and estriol, will be done to assess for neural tube defects, chromosomal abnormalities such as trisomy 21 or 18, or gastrochesis, a birth defect in which the intestines are outside the abdomen. These two women are embarking on their 9-month journey through pregnancy. They are both hopeful it will be uneventful and they will have happy, healthy babies.